And the third step in this particular goal was to educate all Americans about the threat of HIV and how to prevent it. I think what was striking in the videos that were shown was really the emphasis on self-awareness and learning, because that allows you to actually speak to clients and speak to folks that you're meeting in your various settings from a place where you can educate them and they can hear you in a way that doesn't happen unless you have that level of self-awareness. The second goal in the National HIV Strategy is increasing access to care and improving health outcomes of people living with HIV. The first target in this area is to increase the proportion of patients linked to care within 3 months of HIV diagnosis from 65% to 85%. So again, let me tell you where we are in the state of Maryland. With new cases, that 1,430 people that we said in 2010 were diagnosed, about 68% of them were linked to care within 3 months of their HIV diagnosis. So pretty good, around the 65%, but nowhere near the 85% that we actually need to link to care within 3 months of their diagnosis. Of those folks who were actually diagnosed, their median CD4 count within 12 months of their HIV diagnosis was 327. So better than 200. But still not where we want it to be, which is more in the 500 to 1,000 range, I think. The bad news was that we're not so good with retaining people living with HIV in care. So we're pretty good about getting people from the test to the first appointment, but then keeping them in care, we drop off. So of our close to 30,000 living HIV cases, about 46% of them were in care, with a median CD4 count of 451. So we drop off from about 68% who go to the first visit or first couple of visits down to 46% who then are in care over the next 12 months. And although we don't have complete data yet, and I really don't think you should quote me on the statistic because it's not complete data, we did do sort of a quick back-of-the-envelope calculation with the data we currently have, and that indicates that of the roughly 46% people living with HIV who are retained in care, only 49% of those are actually virally suppressed. So it's a fairly small number when you winnow it down. And I'm going to show you a slide after I get through the third goal that's going to show you why knowing where people are on that spectrum is so important. So the other two targets related to this goal are increase the proportion of Ryan White HIV program clients in continuous care from 73% to 80%, and increase the number of Ryan White clients with permanent housing from 82% to 86%. And I think you've already heard folks speak about the importance of structural interventions like housing and like having a job can be for people getting diagnosed and then staying in care. So the steps for this goal are: step number one, establish a seamless system to immediately link people to continuous and coordinated quality care when they learn they are HIV infected. You've already heard folks allude to the fact that the testing initiative here in the emergency department does exactly that, and many of you who participated in the video spoke about that. Someone's diagnosed in the emergency department and they are immediately walked over to the JOCS initiative and given an appointment and engaged in care so that they can have that. That's a model that does need to be the norm across any hospital system and certainly across any system of care that we have here in the country. Step two, adopt policies that increase the number and diversity of healthcare providers that specialize in HIV care and related services. That's really part of your campus strategic plan, if I read things correctly. Innovation and education, research, clinical care, and public service. And the other part of your campus strategic plan is creating a culture of diversity and inclusion. I think it's also really important to note that that doesn't only apply here to the campus, but you all have such a reputation in the country and in the world, and such a diversity of students who are coming here. You really have the opportunity to make a difference across the world. And I appreciated the gentleman in the flash mob who said he would be taking that information back to Nigeria. That really is a great example of the impact that this will have, these initiatives will have, not only here in the city, but also across the world. And then step 3, support people living with HIV with co-occurring health conditions by reducing barriers that impede access to services or present challenges to meeting their basic needs. So I have just a couple of data statistics related to that one. We had a project that was called the Medical Monitoring Project, and it was a small sample size and only 244 people, but we went in and basically looked at comorbidities for these 244 folks. And we found out that 11% of them were homeless in the past 12 months. 5% of them had been incarcerated in the past 12 months. 26% of them had accessed mental health counseling in the past 12 months. 34% had injected drugs at some point in their lifetime. 34% of them had used alcohol or other types of non-injecting drugs in the past 12 months. And 52% of them had received public assistance at some point in the project. So I think it's important to really understand that these are true co-occurring comorbidities that happen that are barriers to people accessing quality health services. I know from personal experience that at the School of Social Work, there is actually an advanced human behavior course that teaches about these issues and has field placements that provide experience with HIV, substance abuse, and mental health. These types of courses should be embedded or replicated in other classes in the school. I happen to know that because Stephanie Pons, who's sitting out in the audience, teaches that course and asked me to come guest lecture at one of the classes. In addition, at the School of Law, there's a long-standing legal clinic that over the years has worked on employment discrimination issues, child custody, guardianship needs, and has provided students with the opportunity to travel to other parts of the country and the world to work on policy-related issues. That's an important model to realize because as we break down the barriers between HIV prevention and HIV care and focus on the continuum of care and prevention, building the knowledge and skills across the discipline will empower you and allow you to work more effectively wherever you choose to be in the city, in the state, or in the country. The third and last goal of the National HIV Strategy is reducing HIV-related health disparities. And the target for that one is to increase the proportion of HIV-diagnosed gay and bisexual men, blacks, Latinos with undetectable viral load by 20%. Unfortunately, we don't yet have good data on that particular one, so we still have some work to do. What we do know is that 1 in 60 non-Hispanic black persons in Maryland are HIV positive compared to 1 out of every 608 non-Hispanic white persons in the state of Maryland. That's a huge health disparity that we have, and we have a lot of work to do to reduce the disproportionate impact of HIV on these specific populations. So the steps to get there in this particular goal is step 1, reduce mortality in high-risk communities by ensuring that African Americans, Latinos, gay and bisexual men have access to regular viral loads and CD4 tests. One of the key things I heard throughout the video was really the opportunity to build cultural competency. Cultural competency for engaging disproportionately impacted populations. I heard a theme of building a culture of health literacy. Our clients, in order to have better health outcomes, have to understand how to work in a healthcare system and to be health literate. I also heard building an expectation for positive health outcomes across campus disciplines, and that will benefit not only the health of your own campus, but certainly the health of the city. The second step is to develop innovative solutions at the community level to reduce HIV infection. And the third step is to reduce discrimination and stigma against people living with HIV. For those of you who are familiar with our administration, we say basically 3 things whenever we go out into community. Talk about HIV. Talking openly about HIV reduces stigma and discrimination. Get tested. Normalizing the testing process makes it part of our own expectations and our clients' expectations for a clinical visit. And get treatment, because being on treatment, as we've already talked about, is the key to really reducing transmission and also better health outcomes. So as you can tell from that brief overview of the 3 goals of the National HIV/AIDS Strategy, this is an incredibly important foundation for the country and for our state. And we really can use it to focus on these key targets and these steps along the way to achieving those. And I think using it in your discussions today, this afternoon, will really provide you with a framework in which to place your work and your role in what you're trying to achieve. The other very important framework that I just want to very quickly share with you is this slide right here. And I think it's important to have you look at it and encourage you to think about where your work fits into it. For those of you who may or may not have seen it, it's affectionately known as the Gardener Cascade. And that's because the person who published the papers was Dr. Gardener. I think the really important thing that it shows us is that of the 1 million estimated people living with HIV, only 874 of them have actually been diagnosed. So there's still 20% of individuals that have HIV and don't yet know their status. And of the ones who have been tested, only 656,000 of them are linked to care. So we still have some work around getting a person from that initial test to a care provider for a first visit, just a first visit. Of those who are linked to care, only 437,000 of them are in ongoing care beyond that first visit or so. And of those in care, only 262,000, or slightly more than half, are actually on medication. And of those on medication, only 210,000 are virally suppressed. Or another way to say it is, of the estimated 1 million people living with HIV, only 19% of them have achieved viral suppression. I think that's a very powerful message and a very powerful cascade that calls us to look at where we are on the continuum. Where is our work on the continuum? Are you testing? Are you engaging people in care? Are you retaining people in care? Are you providing them with all the supports that they need to take their medications? And then are they taking their medications with positive health outcomes? If you think about all the challenges and barriers along that path, so infected but never offered a test, even though they've come to the emergency room or come into their primary care providers numerous times but never got that test. If they were tested but they couldn't overcome the stigma to get to the doctor's office, or wanted to but couldn't because they didn't have any insurance and didn't know that there are other options out there. If they got to the doctor's office but the staff weren't culturally competent when they got there, so they never came back again. If they got there and they stayed there, but they had a hard time taking their medications consistently. If you think about all of those things and think about your work and your professional role as a doctor, a social worker, an educator, a professor, a dentist, a lawyer, a nurse, you know that we have a lot of work to do together across the cascade. So, and I applaud you in committing both yourself and the campus to ending the HIV epidemic. Because you come from many different schools, disciplines, and backgrounds, you each have a role in achieving the goals of the National HIV/AIDS Strategy. And the work that each of you do every day can have a positive impact on our communities, and particularly on people living with HIV and their families. You can and will help us to finally turn the tide against HIV, not only in our state, but around the world. I know that during the rest of the day, you will have opportunities to engage with with your colleagues, learn from your colleagues, and take this knowledge back to your classrooms, workplaces, practices, and communities. So I thank you for the opportunity to talk with you today about the National HIV/AIDS Strategy. And on behalf of our Maryland Department of Health and Mental Hygiene, Infectious Disease and Environmental Health Administration, thank you for your participation. Enjoy the rest of the summit.